My name is Alan Mills. I'm the Executive Director of the Uptown People's Law Center. Rob earlier mentioned the Lippert case. We're one of the many lawyers filing that case and pursuing that case. Class action case saying that the medical care that's being given in the Department of Illinois, in the prison system in Illinois, is not just bad, but it's so bad that it constitutes punishment. It constitutes punishment that is unconstitutional because it is cruel, it is unusual, it needs to end. So what do we do about it? As we said at the very beginning, problem number one is we simply have too many people in prison. We lock up people for simple drug crimes where they ought to be treated as a public health problem, not as a criminal act at all. Even for people who have serious crimes, we lock them up way, way too long. The United States is an outlier. We have more people in prison than any other country in the world, including China and India, which have many times more people than we do. But just in terms of actual people, we lock up more. We also have the highest rate of incarceration in the entire world. A rate of incarceration which has never been seen anywhere in the world, anywhere in history. We do that in the United States. That means in Illinois, we have between 150 and 175% of what we should have just for capacity of the prisons that we currently have. We have way too many people. We don't have enough beds for them. We certainly don't have enough services for them. We've cut all the educational programs. And frankly, we spend a lot of money on medical care, but not nearly enough. Illinois has also one of the oldest prison populations in the country. We're number 4 in the percentage of our prisoners that are over the age of 55. We have a lot of prisoners, and a lot of them are old, a lot of them are sick. But we spend less than almost every other state in the country. Oklahoma and South Carolina are beating us, but otherwise we spend less per prisoner than every other state in the country. We're at the bottom of the barrel. California spends about 5 times per prisoner what we do, and that's the state, which was mentioned a little bit earlier, that's the state that the United States Supreme Court found was so unconstitutional that there was no way to fix it other than to let people go home. They simply could not be treated in prison. And they spend 5 times per prisoner what we do. Illinois' system is in crisis. You've heard a few of those stories. I represent a man who had his leg chopped off because of untreated diabetes. He lost his entire leg. His story is in the pamphlet, page 19. I won't repeat it now. Why should we care? Well, first of all, me as a person doesn't want to live in a society that treats people this way without trying to change it. It's a basic human right. I don't care what you did. From a much more practical point, 90 to 95% of the people in prison are coming home. They are going to be our neighbors. If they are released as broken people, then it will be on us to take care of them through Social Security, through public aid, in our hospitals, etc. Don't break them when they're in prison. Prison is supposed to cure them, not break them. But we send out broken people every day. We at the Law Center also do disability work. We represent a lot of former prisoners who are broken to the extent they will never be able to work again after they finish their sentence. It doesn't help us on the outside. But most importantly, and I'm asked this all the time, well, we have a budget crisis in Illinois. How are we supposed to balance all these things? How can we spend money on prison health care when we can't even fund child care on the outside? It's not either or. We have to do both. But most importantly, the Constitution doesn't make us balance, doesn't let us balance things. There are constitutional minimums. There are constitutional requirements that if we lock somebody up, we take care of them. So what do we have to do here to fix this problem? First of all, we've listed a whole 16 recommendations in our report here. They're on pages 5 to 6. I'm not going to go through all 16 of them. And I have to give credit. The base here was done by John Howard Association. They put out a very good report. They came up with most of these recommendations. Maya Sela, who could not be here tonight, wrote most of that report and put in tremendous hard work, as did Ted Pearson and his group, putting together the basic outline here. Everything we've done is built on that. What do? We decarcerate. We close some prisons, we send people home, we stop sending people in every month. Second of all, we improve access to care. We get rid of the $5 copay because it incentivizes people to sit around and wait until things are really bad. We hire more doctors and nurses and physician's assistants and nurses' assistants and licensed nurse practitioners and everybody else in the medical care system so that when you have a problem, you are not seen a year later. You are seen then. We make sure that there is oversight. We need an independent, and I emphasize, independent ombudsman who, when a prisoner says, I'm being treated with an inhaler and in fact I have cancer, it's not just the doctor on staff who looks at it, it's somebody independent from the outside with a team of medical experts who can say, you know what, Wexford, you're wrong. Do something about it. A man shouldn't have to die before we review his medical records. And finally, there has to be more oversight by the state itself. We have one doctor who's supposed to be supervising the care for all 49,000 people. That makes no sense. We have to have, if we're going to have a private contract, there has to be good internal controls to make sure that when mistakes happen, they are identified and corrected, not just churn paper. That's what has to happen here. If we're going to have a prison system of 49,000 people, it's going to cost us more money. There's just no way around it. I don't care what budget crisis you have. The Constitution requires it. Basic humanity requires it. We have to do it.